Multiple sclerosis is a disease that is better caught and treated early. Unfortunately, many patients can skip that recognition, which can cost them disability and also worsen quality of life. The sooner we can get these patients diagnosed and treated, the better outcome we'll have, not only for the measure of disability, but for all over quality of life. Hoag is a pinnacle of health in Southern California. We do multidisciplinary care. We are spread out across all disciplines of neurosciences. We started this program about 5 years ago now with an N of 1. We call it 1 patient. Now we have more than 700 patients. Services expanded significantly, and we have incorporated new technology in imaging. We have an infusion center. We've added Nurse Navigator program. We have established the MS Hope Center, which is a very unique program where patients can come once a month. They do different activities such as physical therapy, occupational therapy. We invite speakers to educate them about some of the new concepts in multiple sclerosis. There's still a lot of patients out there that need care. So we're doing our best here in Hoag to expand our care access so we can absorb as much of the deficit that we can in this region.
I can't say enough about Hoag, the center. They deal with people who are really struggling physically and psychologically, and they're just so cheerful and they're so accessible. Whatever's troubling you, whatever's on your mind physically or anywhere else, they just find a way to help you.
MS is a very evolving disease, a very rapidly evolving disease. Imaging has been a challenge in multiple sclerosis for a while. As of recent, there have been some efforts by many researchers to identify new ways to look at imaging in multiple sclerosis.
With technological improvements in MRI scanners and protocols, our images are higher resolution than ever, and we're able to visualize MS lesions better than we ever have before. There's a growing need not just to see lesions better, but to quantify them and track changes in lesion burden over time. We've implemented MS-specific MRI protocols to help our fellowship-trained neuroradiologists improve detection, classification, and long-term follow-up of lesions. To support this, we use advanced AI-based software like IcoBrain MS to augment our interpretation. It helps us detect inflammatory lesions, quantify them objectively, and track longitudinal changes across serial scans. The software also allows us to monitor brain volume, which is an important marker of neurodegeneration in MS and can help predict disease progression. We also have early access to a research tool in development which supports detection of more specific imaging biomarkers such as the central vein sign and paramagnetic rim lesions. These tools reflect Hoag's commitment to pairing advanced technology with subspecialty expertise to deliver more personalized and precise MS care.
This is going to be the future of imaging in multiple sclerosis, and we want to be one of the first providers that can give that service to the patient.
Research is really a discovery of new science. So translation research is taking the patient bedside to the lab. So we're learning from our patients, and then what we learn, we take back to the patient. So it's that process where research interfaces with clinical care.
This research that we're doing here at Hoag is biomarker discovery. We're doing proteomic analysis to find the proteins in these high-risk individuals. These are the individuals of the family members of patients with MS. This way we can detect MS early, and we can intervene early before the disease is progressed.
Hoag has a really unique program of fostering research. The community provides funds through what's called the Innovators Fund and Program. Doctors can apply to get money from that to bring new innovations to Hoag that will improve the care of the patients.
The future of MS is precision. So it's going to be at the submolecular levels. We're probably going to start using cleaner targets. We're going to try to use less problematic therapies. We will see a lot of molecular therapies and submolecular therapies. CAR-T is a novel therapy, and it's basically engineering of an immune cell to be able to carry a new identifier and expand those breed of cells, or create, if you want to call them, and get them back to the patient to try to attack a certain target.
The intent is that they will control and get rid of the causative factor that is promoting their multiple sclerosis or their neuropathic condition, and be able to control it in a way where they won't need continuous therapy with one medication or another. And we intend to expand on those CAR T trials into different arenas of neurology.
We're expanding because there's a need for us to expand. The region is in need for excellent neurological care. Hoag is not going to stop before having that. We are adding not only more subspecialties, but we're adding talent. We're on a national quest to attract and recruit the best talent out there in many neurological disciplines. We're now a comprehensive care center for multiple sclerosis. This is the highest designation from the MS Society. We are at probably the top or the elite sites where MS care can be provided in the region. Our patients, they can put their trust in us, because to be a comprehensive care center is not only a responsibility, but it's also a fulfillment to our patients' expectations.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.